Welcome, everyone. Thank you for being here today. We're thrilled to have so many wonderful people joining us for this event. My name is Nikita Viswasam, and I'm part of the communications team at Right to Health Action. Right to Health Action came together during the first days of the lockdown as a group of people united in anger to be facing another pandemic that never should have happened. We've since grown into a 50 states grassroots movement of frontline health workers, people who have lost loved ones, COVID survivors, and emerging leaders, students, and youth who believe health is a human right worth fighting for. As we enter our second year as an organization, and the number of lives lost continues to mount, we are at a precipice. We're literally on the verge of passing through the United States Congress, the biggest global health bill in a generation or more, and we're also extremely close to losing. Although Congress is in session until the end of the year, there are only 14 days more of floor time when our elected officials are actually voting, and even 4 of those days are half days. We face an enormous uphill battle and need all hands on deck for an exciting, desperate 6-week drive to change history. Tonight, you'll learn about what we're fighting for and then break into small groups to learn how to help. During this razor's edge moment, it is more important than ever to center and look up the stories of people from the front lines who are fighting for the People's Pandemic Prevention Plan, in spite of and because of the physical and emotional damage of COVID-19. I'd like to introduce Andrea Musken. She's an educator who is originally from Romania and moved to the US to pursue a graduate degree. She's built a life in North Carolina with her husband and 4-year-old daughter, but most of her family still lives in Romania. With the pandemic, it's been difficult to be separated on 2 different continents, especially as her family has experienced several deaths of loved ones. Thank you for being here today to share your story with us, Andrea. Over to you. Andrea, can you unmute yourself?
Hi, thank you, Nikita. So my name is Andrea. This is my first time doing this, so please bear with me. Okay, so what I would like to share with you today is my mom's story. So I was born in Romania and moved to the US to pursue my studies. And after obtaining my degree, I stayed and started a life and a family here. My husband and 4-year-old daughter and I live in North Carolina. My mom and the rest of my family lived in Romania. She would visit us once or twice a year to see my daughter and spend time with us. She loved these trips and we loved having her with us. When the pandemic hit, like so many others, we were limited to talking over the phone. One day in February this year, I called my family and no one picked up. It turned out my mom, my grandmother, and brother all had COVID. I would like to tell you a little bit more about my mom. My mom was a single mother of 2 who had dedicated her life to raising me and my brother, taking care of my grandparents and working as a nurse for over 40 years in Romania. My mother was all about service. She continued to work with respiratory patients throughout this pandemic because she loved her work. My mom advocated for her patients when no one else would. Unfortunately, she did not have access to N95s and other safety PPE beyond a surgical mask. This is what she was wearing throughout the pandemic. This is how she caught COVID during an outbreak at her clinic. While at home with COVID, she cared for my grandmother and brother, who were also ill. She waited to admit herself to the hospital as long as she possibly could, because she knew that my grandmother would not receive the care she needed. Romanian hospitals routinely withhold care to people over 70, even before the pandemic. So she knew my grandmother would not receive the care she needed. Ultimately, my mom had no choice but to admit herself to the hospital. When she got there, the hospital was at capacity and she had to wait in the ER until someone died. So there was room for her. When her condition deteriorated, she again had to wait until someone else died and an ICU bed opened up so she could have it. We were told that she was lucky to get a bed because she was a nurse and the people at the hospital were aware of this. My mom's cell phone was taken away when they transferred her to the ICU. After several days of her being in the ICU, We found out that there was a phone in the hospital unit. We called daily, and a few times we were able to get through and say a few words to her. We were not able to see her. These phone calls were the hardest I have ever made. Hearing her gasp for air and suffocate was absolutely heart-wrenching. Her voice was changed, and she was hard to understand. During our last days, she begged us to get her out of that hospital, but we couldn't because it was the only hospital in the area. At the very end, I was able to talk to a doctor about consent to be intubated. I wanted to make sure that she wanted it. This is not the norm in Romania, and neither are any end-of-life decisions for patients or family members. After my mom and grandmother died, we could not travel to Romania for the funerals because of quarantine rules, and my doctor told me it was not safe as we would risk the same fate, basically. Like many others who have lost loved ones in this pandemic, our grief has been complicated by the absence of rituals and family support. It has been most heartbreaking to see the impact these losses have had on my 4-year-old. She's struggling with interactions with her peers and teachers at school. She doesn't play or talk to other kids. She knows she or a loved one could die if contacting this virus. She's scared. She also carries the burden of educating her peers on COVID safety. My 4-year-old makes sure that her peers wear their masks correctly and maintain distance. When talking about the arrival of fall this year, she recently said to me, "Mom, so many people will not see the leaves change this year because they will die of COVID." I'm sharing my mother's story, my daughter's and my family's stories with you today in the hope that further loss can be prevented and that future pandemics can be prevented. My husband and I have now lost 3 family members to this virus, and my brother is still recovering from the long-term effects of hospitalization. I'm asking you to make sure lasting change happens so that other families don't have to live through what we are living through right now. Thank you.
Thank you so much for sharing your powerful story with us tonight, Andrea. I'm so sorry for your loss. Your experiences and those of countless others worldwide really drive home the importance of fighting for the transformative changes we need to make sure this never happens again. Stopping COVID requires vaccinating the rest of the world as soon as possible to stop new variants from spreading. It requires a global fund for pandemics that supports health systems around the world and works to prevent zoonotic disease spillover at the source before they happen. In late July, we had a monumental win in this fight when the Senate Foreign Relations Committee passed Senate Bill 2297, the International Pandemic Preparedness and COVID Relief Act. A version of this bill has already passed the US House, with all Democrats and 90 Republicans supporting. This bipartisan bill includes a mandate for the United States to lead a global effort to vaccinate at least 60% of the people in low and middle income countries worldwide by mid-22. The bill also establishes the Fund for Global Health Security, a new catalytic fund for pandemic prevention and preparedness to help resource-constrained countries strengthen their health systems, meet WHO standards, prevent new zoonotic disease spillover, improve surveillance and reporting, and have in place the supply chains, surge capacity, and lab systems needed to pandemic-proof the planet. Today, we'll be getting into the details of why the world needs a global pandemic fund and how we can work together to get this bill passed into law. Right to Health Action is mobilizing more than 100 meetings with members of Congress each and every month in every US state, and we're going to go into overdrive in the next 6 weeks. We fight alongside many other organizations who are key partners and leaders in this campaign to pandemic-proof the planet. Today, we're joined by representatives from 2 of these long-standing advocacy groups, Management Sciences for Health and Conservation International. We're so grateful and honored to have these 2 speakers with us today to discuss the specifics of this bill and how we can work to prevent pandemics in the future. Before I hand it over to our moderator, Paul Davis, I want to take this opportunity to thank him and our 2 panelists, as well as our Right to Health team members who have joined us for multiple meetings to make this event happen. If you're interested in being involved in our community going forward, we'll be following up with information on how that's possible. Let me also quickly cover the agenda for this evening. Following our panel and an audience questions, we'll invite each of you to join a short small group discussion to debrief, connect with other like-minded advocates, and learn how to plug in. We have a team of trained small group facilitators who've stepped up to create space for these conversations and help us close out the event. And we want to offer a huge thanks to them for taking this on. A couple notes on technology. All attendees will be muted during the panel discussion. If you have to leave the meeting at any point or get kicked out and want to rejoin, simply use the same link you originally joined with. You can submit questions via the chat at any time. We'll refer these questions during our Q&A time following the panel discussion. We're also recording the panel portion of this webinar to be shared within the coming week. After the panel and Q&A, we'll share specific instructions surrounding logistics for moving into small group discussions, where we will close out the webinar following our conversation. And with that, let me introduce Paul Davis. Paul is a longtime HIV and social justice advocate, policy wonk, and is currently the policy director for Right to Action. Paul co-led grassroots and legislative campaigns that won 99% reductions in HIV drug prices for impoverished countries and got life-saving medicines to 26 million people with HIV worldwide through the Global Fund to fight AIDS, TB, and malaria, and the President's Emergency Plan for AIDS Relief. After working in Kenya for 5 years, he returned to help organize a 150-plus city nationwide bird dog civil disobedience movement to save the ACA, oppose Trump tax cuts, and strike at other post-2016 flashpoints. Paul is an alum of ACT-UP, Partners in Health, Universities Allied for Essential Medicines, Knowledge Ecology International, Doctors for America, and the Seattle Tenants Union, and co-founded Health Gap and Bird Dog Nation. Paul, thank you so much for joining us and moderating today's panel. I'll let you go ahead and share a bit more about your work, our speakers, and the focus of today's discussion.
Thank you, Nikita. I surely don't need to say anything else about my work after all that, but I'll talk about the awesome panelists that we have here. But I did want to just appreciate Andrea for sharing her story. It's horrific that there are 700,000 stories like that in the United States alone, more than 700,000, and millions worldwide. And for every person who has, for every single person who has died, there are many more people who have been directly impacted. So it's a horror, and thank you for grounding us, Andrea, and why we're fighting and what we're fighting for. Today we're lucky to have Neil Vora. Is a physician with Conservation International, where he leads its efforts on pandemic prevention. Throughout his career, he focused on the link between human health and the health of the planet, particularly as it relates to the increasing threat of spillover viruses from animals to humans. We'll talk a little bit more about that, in fact. He served for nearly a decade with the CDC, including as an epidemic intelligence service officer and a commander in the U.S. Public Health Services. Neil deployed for the CDC to Liberia in 2014 and to the Democratic Republic of Congo in 2019 to help with the largest outbreaks of Ebola ever in history. For his work, he has received numerous accolades, including the U.S. Public Health Service Physician Researcher of the Year Award, the CDC James H. Steele Veterinary Public Health Award, CDC Donald C. Mackle Memorial Award, and oh my goodness, a long list of other good things. Courtney, so thank you, Neil. Courtney Carson is a global health and international development expert with over 10 years of experience. I'm working at the nexus of public policy, advocacy, and communications. He does really leads a lot of the incredibly important work that our colleagues at the Pandemic Action Network are leading, and we're very grateful to have her as well. Previously, Courtney managed policy and advocacy at Women Deliver, securing gains for girls and women's health and rights with the United Nations, WHO, and moving toward universal health coverage. She led U.S. policy for the Global Health Technologies Coalition, which advances research and development for neglected and emerging global health concerns. Before her career in advocacy, Courtney led global health policy for U.S. Senator Chris Coons, chair of the Senate Foreign Relations Subcommittee on Africa, and chair of the Caucus on Malaria and Neglected Tropical Diseases, where she upheld U.S. commitment and investment, and where she worked with the senator to really be a strong leader on global health. So she, in addition to helping lead the Pandemic Action Network now, used to help lead for our second vice president, Senator Coons. So we're glad to have these folks. If you all would like to introduce yourselves any more for a moment, and we can maybe jump into some questions. Also, people should feel free to put questions in the chat, and we'll get to them. Neil, do you want to introduce yourself or say anything else on top of what I just shared?
No, thank you, Paul. I really appreciate the opportunity to be here with Courtney and you and so many other colleagues on the Zoom. And I also want to extend my my condolences to Andrea about her mother, her grandmother, and like Paul was saying, we just heard too many of these stories in the past year and a half. And so our goal is to reduce that going forward to the extent that we can, and there is hope on the horizon.
Yeah, thanks, Paul. Nothing much more to add from me. It's great to be here with such a powerful group of advocates. It's grassroots and constituent voices that really help drive the change that we need to see. So thank you for the work that you're doing. And I'm excited to be able to talk to you about some of the efforts we're pushing in Washington, D.C. and how you all can help us bring this over the finish line.
Super valuable and very timely. In fact, as has been mentioned earlier, a bill that's just really I worked on PEPFAR and the Global Fund, and those are pretty big deal global health initiatives that really remade the world and contributed to saving millions and millions of lives. What we have on the table for us right now, with 6 weeks to go, is a bigger deal. So I'm very grateful to have our colleagues who are participants in many important coalitions that we all work in, and partners in a lot of our work on the Hill and with the administration. Neil is also a leading voice from the Preventing Pandemics at the Source Coalition. PAN is itself a bit of a coalition, but is also a leading voice in the Global Health Security Roundtable. So there's a lot of firepower speaking with you all tonight. Why don't we kind of start out with what sounds like a simple question, but it's oftentimes the first one that we're asked, is that literally millions of people are suffering and dying and going through extraordinary difficulty right now. Why shouldn't we worry about that and just not really worry about future pandemics and preparing and preventing future pandemics? What do you all say to that? Go ahead, Neil.
I can take a stab at this first, but Paul, you're right on. Too many people continue to die right now. There is inequitable access to vaccines and life-saving interventions such as oxygen. So we absolutely need to continue to address the current pandemic, but we have to be able to walk and chew gum at the same time. In fact, I think it was an article in The Atlantic by Ed Young, in which he describes the rise of the Delta variant as almost a new pandemic in and of itself that was distinct from what we've previously been experiencing with COVID. And we barely learned the lessons from the first year of this tragedy. And many of those same mistakes replayed themselves as the Delta variant of SARS-CoV-2, the cause of COVID-19, emerged right through this past summer. So, that's one aspect of this, that viruses that cause pandemics, such as the virus that causes COVID, can mutate and continue to cause future waves. But thinking even further into the horizon, but also right now, is that there might be another novel infectious disease brewing as we speak and respond to this current pandemic. Since the 1940s, new infectious diseases have been on the rise. This is clearly documented, and the vast majority of new infectious diseases originate from animals, particularly wildlife. And it's how humans are interacting with nature, coupled with global travel, that is driving the emergence of these new infectious diseases. And it is a mistake to say that COVID is a once in a century pandemic. In fact, in the last 100 years, we've had at least 6 other pandemics from viruses, and each of those 6 other pandemics have been caused because of spillover of wildlife viruses into people. And so unless we address those underlying drivers, we're going to continue to be at risk for future pandemics. And those drivers, which we can go into further detail, are only on the rise, right? So the risk of a future pandemic is actually accelerating right now.
Was it Ed Young who also said we failed the dress rehearsal? Courtney, do you have anything to add to that? I'm sure you do. And what do we need? We stole from Pandemic Action Network the key phrase of pandemic proofing the planet because we think it says what we need to do. So what do we need to pandemic proof the planet? Why should we be worried about the future?
I love to talk about pandemic proofing the planet. So glad you guys have picked that phrasing up too. You know, we need to act now, not only because of what Neil was talking about the documented proof that pandemic events are accelerating and more likely to happen in the future, but also because we've seen from the past that we have short attention spans and politicians have attention spans that are even shorter. Many of the recommendations that are coming out about better systems and structures that are needed globally at the country level, regionally, these are recommendations that have been identified before. They're recommendations that came out during the Ebola epidemics. They're recommendations that came out around H1N1, and there has not been the political will or the muscle and investment to change the status quo. And as soon as the immediate crisis fades, attention goes elsewhere, money goes elsewhere, and we put our hands up and walk away and say, oh, okay, that was done. We did an okay job. We can't let that be the case with COVID-19. We need to learn the lessons this time and muscle up with the real political change, the system and structure changes, and importantly, the money that's needed to make these changes sustainable. And we need to do it in the middle of the crisis when we have the political will. If we let things fade, we're going to lose the political momentum that we have, and we can already see that starting to happen. So now is really why we need to both double down on the response and end this pandemic, but at the same time be building for the future, because if we wait, it's going to be too late.
Absolutely. Well, you can see even in the middle of, what is UK experiencing Delta Plus right now, that we all hope won't spread, but there's that even in the package that was announced with some fanfare today, it's quite important, very historic package, the Build Back Better package, but it's still in the round of cost cutting. The president has requested $30 billion, and this request was cut in half. And then if you multiply out the $2.7 billion that was included in the final number over 10 years, then maybe you get to the president's number, but it's all very sketchy. It's like, how can 700,000 deaths become an afterthought? We're not numbers. Actually, when we had a couple of questions we had thought about ahead, but another focus, I suppose, of Senate Bill 2297, the International Pandemic Preparedness and COVID Relief Act of 2021, always a mouthful, which is why people say Senate Bill 2297. One of its features is not only to pandemic proof the planet, but to respond right here and right now by vaccinating the globe, by getting at least 60% of the people vaccinated. So it's very important and exciting to us that this has become kind of a everything bagel package. We're trying to address the right here, right now, as well as preventing in the future. But I don't know if folks, what do you all know about the book? Can you share with the team here about how the bill ensures that America is able to take a stronger lead in vaccinating the world? President Biden is saying good sounding things, but what do we need to do to get it done?
S2297 is an important bill to pass. There are still a lot of other actions we need to push for as an advocacy community to make sure that the US shows up and plays its fair share and leadership role on the global stage to make sure that everyone in the world can get vaccinated. And a big part of that is not only donating the doses of vaccines that are needed, but making sure that we're helping get the vaccines to the people who need them and that they're actually delivered. One of the largest challenges right now with the US effort to help vaccinate the world is that it's not costed to deliver the vaccines. So basically what's costed right now is to sort of deliver the vaccines to a country and then, sorry, see ya. And we know there are real risks and challenges with that approach, because while it may have best intentions, that's not going to actually help people get vaccinated in real time. And not only is that dangerous, but it's completely irresponsible on the half of the US government. So we need to be pushing for that. We also need to be pushing to upscale our ambition and our timeline. President Biden hosted a global COVID-19 summit at the end of October. The end of September, sorry, it's the end of October now. And he was trying to marshal global leaders around vaccinating 70% of the world by this time next year. That is far too long, and we can do better than that. And even if we can't do better than that, we can set really concrete targets to make sure that we hit the target by next year. And we haven't laid the groundwork for that. So what's the plan that's going to get us to 40% vaccination by the end of this year so that we can really be on track to over deliver by this time next year?
That's very awesome. Thank you. And we'll also just note that the bill does require that the bill, Senate Bill 2297, the mouthful bill, it also includes a chapter that puts the president on the hook to lead a global plan to get vaccines to at least 60% of the planet by the first half of next year. We want to aim higher, but it's a bare minimum, and it even tackles, which is very impressive to me for a bipartisan bill. It addresses some of the things that make Republicans nervous around technology transfer and regional manufacturing hubs and negotiations with the pharmaceutical industry. So it's quite a. If we can get this bill done now, it's amazing. I don't know that we'll be able to rebuild this fairly tenuous coalition again. At the summit that Courtney mentioned, a very important summit by the administration, Vice President Harris spoke about an international pandemic preparedness fund. Why do we need a multilateral fund? Why not just do it on our own?
Well, what Courtney and I have been talking about costs money. So certainly the response to COVID right now is going to require money, but also what we need to do to prevent future outbreaks from happening also costs money. And there is massive return on investment if we invest in these upfront solutions, right? If we can prevent outbreaks from happening in the first place, or if an outbreak does happen, because no public health intervention is perfect, right? That much is clear, right? So outbreaks might still happen, but if we can quickly contain them so that they do not become epidemics or pandemics, you, first of all, and most importantly, save many lives. And second of all, you save a lot of money, right? We've had such a large economic hit from this current pandemic. So we've already lost millions of lives and trillions of dollars, right? But what Courtney and I are talking about can be done for an annual global investment of around a few tens of billions of dollars per year, right? And some of these cost estimates vary from one organization to the next. But the bottom line is, this is a drop in the bucket compared to the cost of actually having a full-on pandemic. On top of that, the cost should not be fully borne by any single country. So we need that global fund. And if we can get richer countries of the world, particularly the G20 group of countries, and then other wealthy nations to contribute money, this is going to be such a small cost to save so many lives down the road.
What's important about the proposal for this fund is that it will work with countries directly to help fill and plug the gaps that they have self-identified in their own systems for pandemic preparedness. So in that way, it's really country driven, and it's responding to what countries know that they need to do to better protect their populations and therefore better protect the world. So if Kenya identifies that it has gaps in surveillance, and those are the systems that it wants to help build up, it can apply for funding from the fund. But if Botswana decides that it needs more laboratory capacity and it needs more scientists and technicians who are able to help read diagnostics, it can support that. So that's why this is powerful, is because it works with countries at the level that they need to work, and it's not a top-down approach. It's coming from countries saying, here are our needs to build better systems so that we can prevent some of the failures that we've seen with COVID-19 in our own space.
It's extremely valuable that we try to put countries who are at the front lines at the table. We would, in addition, want to make sure that communities are at the front line. The communities know best what they need and around both preventing the spread of outbreaks and or containing the spread of outbreaks and preventing them from happening in the first place, as Neil mentioned. There's some key ingredients of the Senate bill that in fact are not even a part of the international conversations around ensuring that civil society has protected board seats, that indigenous communities have protected board seats. We think that's enormously valuable. There are a lot of lessons to be learned from the Global Fund to Fight AIDS, Tuberculosis, and Malaria, where communities have a seat at the table. You know, I recall writing a $700 million bill with, being a part of the drafting, a very big, whole nation drafting team in Kenya, but we'd gone around our civil society team and surveyed people all over the country, like, what do you need to be in this bill? And the Swahili people on the coast said we need syringe exchange. And, but so communities were able to demand this. We went to the drafting group and said that, the coast wants syringe exchange and the Robi wants syringe exchange. And, the ministers in the drafting group said, oh, this is illegal. But because civil society was at the table, they were able to leverage and say, well, it's $700 million. It's going to get 1 million people on treatment. How illegal is it? And ultimately the ministers decided it wasn't that illegal. And, so I wonder if there are measures. I think the bill goes a long way. Are there other kinds of measures that y'all would recommend to make sure that frontline communities and sometimes stigmatized populations are able to, those most at risk for new pandemic outbreaks? How can we make sure that those folks are at the table when we're trying to build this new pandemic fund?
I think there's a lot to think about and a lot that we can do better as a global community around inclusive governance, and that includes whatever the shape for a new fund might look like, but also what the broader systems and structures that might be stood up at a global level through the World Health Organization or something else to make sure that everyone's voices are heard, and those who are most affected are those driving the policy solutions that come out. It seems like a difficult process, but it's been done before successfully. So it's incumbent upon those of us in civil society to demand that governments live up to those standards and don't pursue actions that are just tokenistic and provide sort of a speaking opportunity, but no meaningful contributions throughout the process. It's being part of the process from the beginning that's really critical to help build the systems from the bottom up.
We're such a contentious panel. Neil, go ahead.
Yeah, there's no contention here. I agree with everything that Courtney said. And just to reiterate that point that she was making, that there's an ethical imperative to do this right, because we do not want to create new structures that perpetuate longstanding structural racism and colonialism, in which you have rich countries that tend to be European countries or the United States telling other countries how to act and how to implement their solutions. But beyond that, if you take away that, if you're not even looking at it from the ethical point of view, but just from a utilitarian perspective, we are going to get better outcomes if we let the countries be in the driver's seat, right? Driver's seat, because they know what they need for their own unique local circumstances. Just like in the United States, our public health system is not governed by the CDC. The CDC does not tell various states or cities how to implement their public health actions, right? The local jurisdictions at the city and the state level know what is best for their communities, their populations. And the same thing goes on the international global level. The United States does not know what's best for a country in Asia, Africa, or South America, for example.
The people are asking amazing questions in the chat. I know that there's something that this team wanted to also get across. Why don't we, what can we do to help? We'll come back to that. What is the connection between these pandemics and human activity? Asked James. So I know, Neil, you have something to say about that, and Courtney may want to weigh in as well.
Thanks. And I mentioned before that most new infectious diseases originate from animals, particularly wildlife. And we also know that the emergence of new infectious diseases is on the rise. This has been happening since at least the 1940s. So these animal originating infectious diseases are also known as zoonotic diseases. Examples of such diseases include HIV, SARS, MERS, Ebola, probably also COVID-19, right? The list is long. These are not just HIV. Random HIV, right? These are not just random diseases that affect a small portion of the population. These are diseases that have changed the trajectory of human history. And so we have to first of all recognize that we're not talking about some trivial issue. So why are these infectious diseases on the rise? And that's largely because of the human destruction of nature. And I'm particularly referring to three categories of activities. Number one is land use change, particularly from tropical deforestation. Number two is wildlife trade. And number three is poor biosecurity in animal husbandry. So why does deforestation lead to the emergence of new infectious diseases? Because in these rainforests, you have this abundance of wildlife. Many of these wildlife species contain their own viruses. And as we cut down the forest, we increase opportunities for people to come into contact with those wildlife species. Now, many of the species that tend to survive after you clear a rainforest are generalist species that can live alongside people, such as rodents and bats. And those are the same species that can harbor viruses. So on the other hand, the species that tend to disappear are the ones that are narrowly specialized. So I also want to make sure that people leave with the correct impression. Biodiversity does not lead to pandemics, as I've heard some people erroneously state. In fact, biodiversity can be protective against outbreaks, epidemics, and pandemics. But again, the bottom line is, as we destroy nature, we are creating opportunities for those viruses from animals to jump into people and our domestic animals. And the last point I'll make is that this is a very personal topic for me. In that, my childhood dream was to work for the CDC. I spent nearly a decade there. I've responded to so many outbreaks, from rabies to pox viruses to Ebola. And for the past year, I oversaw New York City's COVID contact tracing program. But I had to make the very difficult decision to leave the CDC because I found that in public health, we are not talking enough about why outbreaks happen. We need to do a better job. We need to be thinking about upstream solutions and do primary prevention and stop these outbreaks from happening in the first place, because that is an issue of equity.
Absolutely. Business. Some folks are wondering. It's a bit of a technical question, and I'm not sure we might want to just skip on it, in that it's a sort of oftentimes a long and very country-specific answer. But some folks are asking, they're supporting that it's a country-driven process, but what do you do in a country that's in turmoil? There are big changes happening in Sudan right now, for instance, or there is conflict in Ethiopia, the questioner asked about. I don't know if we have a blanket approach for that, or so it's a very good question. It's one of the stickiest things to deal with in sort of conflict-torn countries, and sometimes there's can be support for civil society or for relief, but sometimes, and this might not be the role of the fund itself.
Answer, Paul, but that was where I was leading with my thoughts, is that pandemic preparedness and prevention needs to be an all hands on deck approach. And there's many ways in which we'll tackle it throughout the world in different countries, in different contexts. The fund is an important tool, but it's not the only tool. We are still going to need foreign aid and humanitarian relief that goes into disaster torn areas. We need resources that come from official development assistance to help shore up stronger health systems around the world. We need domestic financing from different countries to help build their own systems. So the fund is not a silver bullet. We need many ways to get at this. And I sincerely hope that as we're doing this, I saw another question in the chat about how this marries with universal health coverage and primary health care. Sort of lifting all the boats is what's needed to truly prevent pandemics from a health standpoint and be better prepared. We need stronger health systems for everything. And when they're stronger, we can respond to pandemic threats more efficiently and more effectively. So we need multiple investments that come at these challenges from different angles to hopefully get us to a better place where systemically we're more prepared and better funded.
Success for a global fund means that you got to have a bunch of you got to have the globe on board. And, we have been, Pandemic Action Network and Right to Health Action have been calling for this fund for, I don't know, I think we're at 19 and 23 months respectively, or something like that, plus or minus. But we're still far out in front of a lot of the rest of the world. What can we do as advocates to really help bring we need more donor countries to join, philanthropies to join, sort of spillover hotspot countries to join, countries that haven't been able to implement haven't been able to meet their international oh my goodness, I've lost my mind. The international health regulations, they haven't gone through the independent evaluation process. But how can we get more groups on the table so that it's not just Joe Biden and Kamala Harris out there on their own?
Well, I think there is two thoughts. First, I think you all are the experts compared to me on advocacy, and I have so much respect for the many activists on this call right now, and how you have many of you have been involved in standing up amazing life-saving initiatives such as PEPFAR and the Global Fund, right? So I would love to learn from you all about how we can realize this Global Fund. I would say that right now, similar to what Courtney was saying before, we have this finite window before the world moves on to the next crisis, because while we are in the midst of the pandemic right now, there are many in this country and in Europe that believe that we are already in a post-COVID period of history, right? But we are still in the midst of the pandemic. So we need to do everything we can to pass Senate Bill 2297, because that is one of our best hopes for setting up a global fund for pandemics going forward. If we miss this opportunity right now, I am very concerned that in 2022 the opportunity will not arise again. So that's number one. I think that number two, though, the United States is not alone in calling for the need for a global fund. There's a lot of talk about the need for a global fund from a variety of different organizations, or at least different independent panels that have evaluated the current COVID response, calling for the need to set up independent funds to do this sort of work going forward. And there are other countries that would also be that are supportive of this as well.
And one thing I think as advocates we can all pay attention to is the G20 process that's going on right now, and the high-level political leaders meeting that's happening later this week. This was hoped to be a moment where those G20 countries could come together and back a fund. It doesn't look like that's going to happen, but there's still a window of opportunity to change that. And one key thing to sort of disabuse the naysayers is this has been studied and evaluated for a long time.
Yeah.
Many countries and decision makers are just coming to the idea of a fund, but this is a proposal that's been on the table, if even in the background, since the 2014 Ebola crisis. It's been studied, it's been documented. There's just attention on it now because now is the crisis and now is when people care. So this is not a new idea. This is an idea that has legs, that has been extremely researched and with proven need.
And it's just a horror that it's what brought a lot of us together on literally the 4th day of lockdown was, you know, I mean, Right to Health Action has become sort of a COVID army in a way, but at the beginning it was just kind of some global health veterans and some emerging leader colleagues, you know, like our students and, you know, people that we've been in groups, and we got together and we're like, here we are again. This should never have happened. This should not have happened, right? The plans were there, the lessons were there. We've done nothing. So, and now we say there's 700,000 policy failures in the United States. So they were just, I can't be angry enough about this, that we're still here. What are some of the things that we would need to do to get, I don't know, you know, maybe Courtney, you want to give, I've sort of skimmed all around this bill, but like, do you want to describe the situation? And Neil, maybe you want to describe the situation, where we are, why do we have 6 weeks left? What's in this bill? What do we got to do? Like, do you want to take some time with that? That will get us set up, I think, to keep taking action.
Sure. And at the risk of getting a little too wonky, one of the challenges with this bill is because pandemic response and preparedness cover so many facets of life, that means it spans across lots of different government agencies and jurisdictions, which is what is making the bill logistically complicated to pass through the Senate. It was drafted by the Foreign Relations Committee, which handles foreign affairs, but it includes actions that the Department of Health and Human Services will take, that the Department of State will take. I believe it wraps in the National Security Council at the White House and what have you. And that means there's lots of people jockeying for interests to make sure that their agency is respected and protected in how the bill shakes out, which makes it a logistical nightmare to keep moving through the processes. And that's a horrible reason for a bill to fail.
Because the bill does what it needs to do, it brings too many cooks into the kitchen. Because you know, coordination across the U.S. government is actually U.S. government's pretty big. But then everyone wants to get their thing in the mix, and it's very difficult. Looking at 6 weeks left. I'm sorry, Courtney.
Yeah, no, so exactly, Paul. We need to take this out of the turf war state and bring it to the common ground state and say, we need to pass this for the health and security of the United States, but also the health and security of the world. We need to get past our sort of petty differences and move this forward for the greater good. I hope that we're on a path towards that. And our advocacy community has been fortunate to have meetings with some of the staff members who are, you know, responsible for crafting the language tweaks that can get everybody on board. And I'm hopeful that there's action moving on this. So I guess I would say cross your fingers, but don't let up on the gas of what's needed to really drive the urgency of coming to a solution and a compromise quickly. As Paul has brought up many times, this is our window of opportunity. It might not be there in 2022.
Yeah. I'll just say that a bunch of people worked for more than a year. A bill passed on January 28th with Republican support that was extraordinarily bold bill. And then a couple of senators blocked it from just being automatically adopted. And it sat for 12 weeks on hold, 13 weeks before the Senate Help Committee was able to make its set of recommendations, actually write down what bothered them. They only delivered those last night. So that is entirely because a bunch of the coalitions mobilized and wrote the edits for them. And there was also I don't know if we have folks from Washington on today, but y'all had a awfully spicy meeting yesterday with Senator Murray's legislative director that was a lot of fun to sit in on. But I don't need these relationships, Courtney. But anyway, it was really valuable. Neil, what do we need to do to get this across the finish line?
I think it's well, first of all, I would say that the reason for hope is that this bill passed the Senate Foreign Relations Committee with bipartisan support. So that gives me a lot of hope, because I'm seeing some chatter, excuse me, in the chat box about concerns about an anti-science posture, but there is bipartisan support for this. So like Paul was saying, civil society has been very engaged with the staff for various members of Congress to propose various edits to address certain concerns. I am cautiously optimistic that that's moving forward. I would again defer to all of you on this call who have so much more experience in advocacy than me, but I think making calls to your members of Congress, particularly your senators, is going to be very important, because hopefully this bill will make its way to the Senate floor very soon for a vote. And again, it will send such a massive message globally if the US Congress passes this bill that calls for the creation of a global fund, because we also know that the Biden administration is interested in standing up a fund like this. So we will have President Biden will have a very strong mandate from Congress to proceed with setting up this fund.
Yeah, absolutely. We have a lot of work to do, but not much time to do it in. As supporters of the Right to Health Action community, most of y'all know or have hopefully participated in the more than 100 member of Congress meetings that we do every single month with constituents who tell stories like Andrea did, so that these folks can understand some of what we're feeling and feel it up close and personal, and hopefully straighten up and do right. If somebody from Right to Health team could share that the letter action from the webpage, you can automatically send a letter to your Congress critter right now, to your senators right now, is very valuable. They definitely, when we send like 10,000 letters, they sometimes call and thank, sometimes call and complain, and I'd say that either one of those is just fine. So, I think we're going to be moving on in just a couple of minutes to move into small groups to figure out what else we can do to take action individually and with our Congress critters in the coming 6 weeks. But I wanted to make sure that our panelists have gotten in any other kinds of parting words of wisdom of what we need to do and be looking for moving forward to help get this done.
Can I just make one final comment before I sign off? Because I saw a question in the chat about the connection between pandemics and climate change. So just wanted to say two things on this. Climate change is probably the greatest public health threat that we face in the next century. It is going to affect every aspect of life. It already is affecting us in so many severe ways, and those impacts are only going to get worse. Now, pandemics and climate change have a common driver, and that is the loss of tropical forests around the world. I mentioned before how tropical deforestation leads to the emergence of new pathogens, but tropical forests also sequester so much carbon. So as we clear those forests, we're releasing so much carbon into the atmosphere. And many of the solutions, some of the 30% of the solution to stabilize our climate comes from nature-based options, such as saving tropical forests, and those same tropical forests can help us prevent the next pandemic. So that's just a connection that we need to keep in mind. particularly as the next, as COP26, the Conference of the Parties, meet just starting next week in Glasgow to talk about climate mitigation and adaptation. The other thing I would say is that as climate change gets worse, there's going to be impacts on infectious disease emergence because vectors such as mosquitoes will have a changing distribution. So we have to be ready for worsening impacts on infectious disease transmission related to climate change. So we need to be thinking about these existential threats with not in our various silos, but we have to be thinking about common solutions where they exist. And what is in this bill contains part of the solution that can help address both of these issues. And that is about prevention of pandemics through saving rainforests.
I appreciate that very much, Neil. And it's very important for the Right to Health Action community. When we came together so many long months ago, it was definitely looking at that there are environmental drivers, and we have continued to really struggle to link some of the health groups and climate and environment groups together. So it's awesome that all of us together have started to get groups more on the same page. Also, Courtney, I want to appreciate some of the very important work that all of us are doing, that you all have led in some ways to bring out what you got to do to contain an outbreak. Once it happens, man, that's bad, and around meeting and perhaps even expanding, reforming the international health regulations, WHO's minimum health standards that we need to contain pandemics. But Courtney, do you want to speak to any of that, and then we can start wrapping up towards moving into our action groups?
Yeah, just building off Neil's last comments, I think we've all seen very acutely through COVID-19 the intersectionality that's really at the heart of pandemics. It's not just a health issue, it's a climate issue, it's an environmental issue, it's an economic issue, it's a national security issue, it's an education issue, it's you name it, it touches every aspect of our lives, it touches every aspect of society. And that's why we need a robust, really full throttled response, both to end this pandemic, but prepare for the next one. So whether that means the United States marshaling resources from across the government, not just the foreign affairs budget, whether that means resourcing the WHO more strongly, not through voluntary contributions, so that this health organization that we're counting on to protect global public health has the muscle, resources, and authority that it needs, whether that means countries have the capacities and resources to even implement the international health regulations, which is a severe gap right now. I don't want to say it all comes down to money, but it does all come down to the prioritization and the recognition and backing that with resources and action, that this is a whole of society problem that needs a whole of society response.
Absolutely. Y'all are amazing. Thank you very much. Thanks to the panelists. We're grateful for your time. There are many more questions that we'll try to sort out and figure out if we are able to answer them. But I want to pass it back to Nikita to get us prepared to go and do something about it. I appreciate this link that just appeared in the chat, the do something about it link. It's actually a visualization of what a 700,000 look like. Of course, unfortunately, that visualization is out of date. But if you want to donate some hours, donate some cash, we'll use 100% of it for making good trouble. And you'll be connected with your Congress critter within less than a week, probably, certainly within the next 6 weeks. So thanks everyone for the panel. I don't know, I've never figured out how on Zoom you have a round of applause. But if people want to send little applause reactions, they should. I am clap. But thanks a lot. Nikita, are you ready to take it away?
Yep. Thanks, Paul. And thanks so much for sharing, Courtney and Neil. Super supportive of everything that you both have shared today. I wanted to give a huge thank you to all our panelists and moderator for a really engaging discussion, and to all of you for submitting such thoughtful questions. I hope that today's discussion has helped all of us appreciate the fundamental link between vaccine access and putting an end, not just to this pandemic, but all pandemics, creating a pandemic-free future worldwide. If the conversation you heard today struck a chord with you, we encourage you to join us in advocating for the crucial policies discussed by our panelists. There are countless ways for you to get involved with this work, but for today, we'll just focus on 3. One very easy action to take is to send a letter to your senators and urging them to co-sponsor this bill. This action will just take 2 short minutes. Second is you can join the Right to Health Action team in your state and have meetings with members of your Congress, members of Congress to encourage them to support S2297. We pull off 100 MOC meetings every month, including in your state, wherever you are. Third is introduce us to a group of your friends or activist colleagues, and we can talk with them together about what you learned tonight and how to connect with the campaign to vaccinate the world and pandemic-proof the planet. Please refer to the chat box process to access the links to the action items I just spoke about. Thanks to our members helping share those. If you have any other questions about how to get involved, you can put them in the chat or learn more by visiting our website at www.r2haction.org. And please don't hesitate to reach out to us. And you can do that at info@r2haction.org.